Austin may hold a few clues about how to prevent new cases of HIV nationwide. Today, health leaders turn to Central Texas for ideas on how to balance care for patients and potential patients.
KXAN's Wes Rapaport joined the director of the Centers for Disease Control, who's in Austin, to look at how Texas is influencing HIV prevention.
I became positive in '95.
Dominic Miller says society and medicine have changed since his HIV diagnosis almost 25 years ago.
It was rough going through it because a lot of people look down on you just because you were positive. And it's just like any other disability now.
Together we will defeat AIDS in America and beyond.
In his February State of the Union address, President Donald Trump put forward a nationwide plan to reduce HIV infections by 90% in the next decade. To tackle this epidemic, health leaders are watching Texas.
We have every anticipation that Texas is going to be a very big part of it.
Touring a Central Texas HIV testing center, the director of the CDC said more resources in the state's metro areas should mirror the approach in Austin, treating the whole patient.
We are really working really hard to normalize the conversation around sexual health. And we believe that people should think about their sexual health as just their health.
At AIDS Services of Austin, the team offers testing for sexually transmitted infections and promotes overall wellness, like dental and mental health services, targeting low-income and traditionally marginalized communities.
Working on both ends of the spectrum, being able to work with both people who are positive and people who are negative to keep them negative.
Miller says that kind of education saves lives.
When you're HIV positive and you have serious illnesses, you need to be prepared.
Wes Rapaport, KXAN News.
According to the CDC, there are 90,000 people living with HIV right now in Texas, and it is estimated that 15,000 people in Texas have that infection but do not know it.
The city of Austin and Travis County signed on to the Fast Track initiative last year. The goal is to end the AIDS epidemic by 2030. City leaders say more than 4,000 people were living with HIV in Austin in 2016. Travis County leaders say that there are 250 new cases each year, and more than 17% of Central Texans living with HIV are unaware of their status. The Fast Track Initiative's goal is to raise awareness and make HIV treatment more readily available.